The Dutch, I learned, are about 2/3 vaccinated with a bivalent booster for COVID. So there's high level of immunity for COVID in most European countries. They vaccinate in keeping with their civilized lifestyle. There's also national health insurance, so that everyone is a part of their health program and has access to care. Actually, I had an interesting experience. A friend of mine called me last night, said he had a friend, young gay man, who had recently become HIV positive and really wanted to get on treatment. So he called another place in town, and they offered him an appointment on May 27th, which is really more than 2 weeks out. Well, 10 days out. So I checked in with our infectious diseases doc this morning and asked what you could do. And it made my day. She said, we can get him in today at 4:00. I said, he's got transportation problems. She said, we'll send an Uber for him. That was a good experience, not just for me, but for the patient. Hello. Because the idea is to get people on treatment as early as possible here. And the system gets in the way. There are no bad people here. I'm not going to blame the people at that other place. That's not what I'm saying here. It's the system of healthcare that I think it constantly works sluggishly, rule-bound, excludes people unnecessarily. And you have to talk to the right people, because I was on the inside here. Talk to my fellow physician. I get calls like that all the time. Can you tell me about this? Can you help me with that? Here's my problem. What do you suggest? And I'm happy to do it, because you have to know the system, you have to know the channels to navigate. I'd like to see what a single payer system looked like, how that really worked in real life. I've experienced it. I was at an AIDS conference in Italy once and fractured my ankle and was sent to the public hospital, which got me in and out of there in under 2 hours. Clean, efficient, but when it came time to fly, I needed a certificate of flightworthiness. So somehow we got referred to the private hospital side. And we went to the American hospital in Rome, which was on a palm tree lined street and a little fancier. And they got me in and out in an hour. And the total cost to me was $150 for x-rays, clearance, all of that. On the public hospital side, there was no charge at all. I was never charged. That one payer system, at least in my very brief experience, worked well. And even when you kicked it up to the private level, where some of the costs come back to you, I have to pay $150. It was still a remarkable experience and very efficient on both sides, both the public and the private side.